Turning now to testing and the pressure on our statewide healthcare system, we are joined by Dr. Cara Christ, Director of the Arizona Department of Health Services. Dr. Christ, thank you for joining us.
Oh, thank you for having me.
Doctor, let's begin with there's some back and forth about who can be tested, who should be tested. What's the latest right now in the state of Arizona?
So right now, there is a national shortage of the supplies we need to run those tests. So what we are recommending is that high-risk individuals, people who have had contact, who are symptomatic, those that are in hospitals, those that are healthcare workers or required for critical infrastructure, those are the people that we are recommending be prioritized for testing. For individuals that are healthy, may come down with some symptoms, but can stay at home, we are not recommending for testing at this time.
Who would make the determination on that? Is that the primary care physician?
So that would either be the primary care physician or the healthcare worker that you are working with.
Okay, earlier this week you said there would likely be an increase in mid to late April, perhaps a peak in May. How does that translate into the next few weeks here as we move into the spring?
So we know as we increase testing capacity, we are going to see additional cases. And we know that this virus is contagious. It is spreading within our communities. So we do anticipate to see a continual increase in those cases. We are working 80% of the cases from what we are seeing from other parts of the world are going to have a very mild or asymptomatic case, and so can stay home and recover by getting rest, drinking lots of fluids, taking care of your symptoms. But there will be a portion of those individuals who are not mild or asymptomatic and will need either hospitalization or care.
There's some question about the number of beds. One report said 16,000 hospital beds, 1,500 ICU beds, and 1,000 ventilators. Worst case scenario, is Arizona prepared to handle what could be coming later this spring?
So we are lucky. We are behind where other parts of the country who are being significantly impacted. So we have time to prepare. So we are working on building additional capacity in our hospitals, looking at procuring and getting additional ventilators so that we can stay ahead of that curve in Arizona.
There are some communities in rural Arizona that simply don't have a hospital. What would become of patients in need there?
If a patient needs care that's a higher level of care than what is offered in their local community, we can always transport, whether that's by ambulance or by helicopter, to one of those higher acuity facilities in one of our metropolitan areas.
At last report, there were nearly 7,000 tests in a population here in Arizona of about 6 million people. Is there a threshold or a number you'd like to see that would give you some comfort?
So I always want as much data as possible when it comes to population health. I think as of today, we were over 10,000 tests. So our capacity is increasing. And so that's a really good thing. But we know that that's not representative of our community. Very similarly, when we look at flu every year, we know we're just getting the tip of the iceberg because we're just getting those symptomatic people that go into the doctor and actually get tested. But we know that there's a lot of people out there with mild symptoms, and that's kind of what we're expecting or anticipating with this disease.
A high level of uncertainty right now. What is your thought to the public who's watching this and wondering what happens over the next few weeks?
So this is a rapidly evolving situation, and every day we're reviewing the data to see if there are additional recommendations that we would make. What we would encourage people in our communities to do is to take those very simple steps that they can do to prevent either acquiring or transmitting COVID-19 to somebody else. And that's wash your hands with soap and water, use an alcohol-based hand sanitizer, stay home when you are sick, try to stay at home in general so that you are not in crowds of more than 10 people or out where you could be potentially infected. And you want to make sure that you are social distancing. So when you are out in public, make sure that you stay a good 6 feet away from other individuals that are not in your household.
Dr. Christ, are you confident that Arizona has a handle on this pandemic?
Well, with a pandemic, it's always unpredictable, but we have been preparing for a pandemic for years. We are working very closely with our local health departments, our hospitals, our healthcare providers to give them the most accurate and up-to-date information that we have. We have a great healthcare system here in Arizona, and we are doing everything we can to protect that.
Okay, Dr. Christ joining us from Phoenix. Thank you for your time.